Hello, this presentation will be about patient-centered care. My name is Hanan Aboumatar. I'm faculty at the School of Medicine at Johns Hopkins University and lead the Education Development Council at the Johns Hopkins Armstrong Institute for Patient Safety and Quality. My background is in family medicine and preventive medicine. In this presentation, our objectives are that you will be able to list various dimensions of patient-centered care, describe why delivering patient-centered care is a quality improvement aim, how it relates to quality and patient safety, and also to be able to verbalize key components for delivering patient-centered care in the hospital. So, if you put patient-centered care in Google, for example, you would likely get around more than 2 million results. Patient-centered care is a very commonly used term. It's a term that makes people feel good. This has been the topic of many presentations and episodes that has been carried through the media. It's also been a topic that is of interest to research funding agencies. Many advocacy organizations have made it their cause to work around advancing patient-centered care throughout the world. So what does patient-centered care mean? And more importantly, how could we go about making healthcare more patient-centered? Well, to be able to do so, it is essential that we look at healthcare through the patient eyes. Let's follow towards that end a young man's journey through his admission to the hospital to undergo surgery on his knee. So this is Jonathan. Jonathan arrives by taxi for surgery on Monday morning at 8 a.m. Jonathan is a soccer fanatic. He's played soccer all his life. He's sustained several sports injuries, and due to that, he sustained an injury to his right knee that requires him to have surgery. Coming to the hospital, he's really hopeful that this surgery is gonna regain function in his knee, and he would be able to play soccer as well as he's always been able to. So Jonathan comes to admitting, in pretty good spirits, looking around the room. He finds that it's pretty crowded. He notices that many patients have their family members with them. His family lives across the country. I can handle this, he reassured himself. The longer he waited, the more nervous he became. As a first-time hospital patient, he didn't know what to anticipate. What would surgery be like? Would he be able to feel the pain of surgery? How would it be like when he goes back home? What's on Jonathan's mind is in fact something that comes across many patients as they go through their seeking healthcare services. This is the results of an analysis we conducted looking at comments coming back from patients after they have been hospitalized. This is part of usual patient satisfaction surveys that's sent to patients after they stay in the hospital. This particular analysis was conducted among patients who have been admitted to hospitals within the United States. We looked at comments coming back from 300 patients, and we looked at the type of information that they're talking about, the type of concerns they raise, and the general themes that they raised. We have noticed that patients frequently talked about the provider's attitude, whether that be good attitudes, positive attitudes, or not so positive attitudes. Attitudes of nurses, doctors, and all healthcare professionals mattered. They also talked about pain, about their ability to get some rest and get some sleep in the hospital. They talked about how fast people responded to hitting the bed alarm, needing help to go to the toilet, for example. They also talked about the skills, the technical skills of their doctors and nurses. Are they good doctors? Are they able to deliver high quality care to them? They also talked about the general environment they stayed in. Was it clean? Was it too noisy? Was it too hot or too cold? They talked about admission process and the discharge process. They worried about delays in admission, particularly, say, for example, if they're waiting for too long in the emergency room before they get into the hospital. They also frequently mentioned the discharge process and how good or bad they felt, depending on how well these instructions are given to them, whether they really knew what to do, whether they really know their medications, for example, what to watch out for, how to take care of that particular wound they've got. They also mentioned things around food, especially if they're staying for the hospital for quite some time, whether their food was hot or cold, and whether it tasted terrible or was it good. They also talked about whether the nurses and doctors seemed to engage them, whether they actually answered their questions, whether they addressed their concerns. Communication came up quite frequently, talking about different treatment options, for example, and also whether their loved ones can stay with them in the hospital, and if they could, whether there is a couch or a comfortable place that they can actually stay overnight if there is a need to stay overnight. So as you see, there are so many things that are on people's mind as they come through healthcare. And attending to what's on people's mind and what's essential for them to receiving good, high-quality care is the various dimensions that we have came to talk about as patient-centeredness of care. So there are multiple dimensions to patient-centered care, and we have listed here the various dimensions as agreed upon by many authorities within the medical literature and also by major healthcare organizations and advocacy organizations. So at the top of the list is really respecting the patient needs, their values and preferences, focusing on the patient as a whole person and offering them emotional support, offering them measures that alleviate their physical discomfort. Also, integral to patient-centeredness is being able to communicate well with patients and family members, to share information, and to provide education to patients, to provide them the means by which they can really manage their conditions. Also essential is strengthening the relationship between patients and their providers, and including family and friends as their essential support system. And in addition, coordinating cares, because nowadays we know healthcare delivery is a team's sport. And for any particular patient, there are many providers that at many times are taking care of them. So making sure that the patients are well taken care of in the hospital and outside the hospital, and when they go to the emergency room. That type of care needs coordination, especially with patients who have multiple medical conditions. So coming back to Jonathan, let's follow up on his journey in the hospital. Let's see whether Jonathan can answer yes to 3 questions. Those are essential questions that we have found out based on literature review and based on major issues that come up in healthcare to be really an essential component to delivering high-quality patient-centered care. So the first question is, would Jonathan's need be met in the hospital? Would he be involved in hospital care to the extent that he would need to and he desires to? And would he be well prepared to take care of his condition as he leaves home? So what does it mean to meet a patient's need in the hospital? So Jonathan, for example, came to the hospital. He experienced some insurance problems as he was coming in that got straightened out but made him feel a little bit embarrassed as he was taking care of these issues. He then was led through a series of preoperative tests. He didn't know what he was coming to do next. Through his mind, he had so many questions. People around him were so busy. They had little time to respond to his queries. He wasn't sure who was in charge. Should he call his doctor Was there time to call the surgeon? Was the surgeon really the person in charge here? He had seen so many people till then. This was Jonathan's last thoughts before he went under anesthesia. So a few hours later, Jonathan's surgery was done, was finished. It was declared a success. Everything went according to the plan for Jonathan. But around 1 a.m., he awoke in great pain. He reached for the call button, but it didn't seem to work. Finally, a nurse responded. She told him, "We can't give you more medications for 2 more hours. I'll page the attending, though." 40 minutes passed. Still in pain and very tired and eager to get some sleep, Jonathan pushed the call button again. This time, the nurse seems irritated. "I'll page the doctor once more," she snapped. Hours later, after a second round of pain medication, Jonathan dozed off. Briefly, though, only to be startled awake by bright lights and a loud voice saying, "Time for your morning blood draw." So, Jonathan's experience with pain, is that common? Does that happen? Or is that a really exceptional situation? What do patients say in general about their pain management during hospital stay? Well, in the United States, there have been a major emphasis on addressing pain during treatment of patients, particularly during their hospitalizations. And pain assessment is now called the sixth vital sign, that all patients need to be assessed for pain and their pain needs to be properly managed. Because of that, we currently ask questions about pain for all patients who get admitted to the hospital. This is an analysis that shows actually the results from patient responses about how well their pain was managed during their hospital stay. The analysis depicts 5 of the hospitals associated with Johns Hopkins and also the national mean in terms of patient reports and the scores of the best hospitals within the US. So what you see on your y-axis is the percent of patients reporting that their pain was always well controlled. And what you notice is that the range of patients reporting that their pain was always well controlled ranged from 65% all the way to 71% among the 5 local hospitals that we looked at the data for. And the median nationally is about 69%, and also among best scoring hospitals that is 79%. So that means 20%, the rest of the patients, do not say that their pain is always well controlled. So regarding pain control, what could be done? Well, first we want to make sure that all pain orders are written in a timely manner. We want to anticipate patient needs. We want to respond to patient pain complaints promptly. This shows the patient that we care. And even when pain is difficult to control, attention to the patient in a prompt manner makes them feel well cared for and reassures them. If you practice in any setting where there are pain consultants, that is always useful to do in case, in particular patients where you need additional attention to the pain. In the US, many hospitals do have a pain consulting service, and those people could be consulted as need be. So, if you recall our 3 main areas that we were covering through Jonathan's journey, the first one was meeting patient needs. Patient needs, we talked about pain. There are other needs, essential needs that patients need. Patients are highly vulnerable in the hospital. Other things that they might need is definitely food. They need to be warm. They need to be able to sleep, and otherwise they get to be too tired, and that can actually interfere with the recovery process. Obviously, failure to address patient needs can influence their ability to participate in their care, to ask their questions, and understand the clinician's recommendations. So moving along to the next core question, would Jonathan be involved in his hospital care to the extent that he desires? So Jonathan's surgery, as we mentioned, was successful. With time, though, he saw the downside of having a successful surgery. Everyone considered his case to be unproblematic, so he received very little attention or information from the busy staff. Although they were efficient, no one asked for his input, and no one explained the big picture. What is going to be happening with him? What is the broad general treatment plan for him? They told him, you're better today. He did not understand where he's heading. So how can we ensure that patients are involved in their care? Well, speaking with them daily is important. Discuss the care plan and what are the goals for that day. Take into account the patient values and preferences as you talk and formulate your treatment plan. Explain what will be happening. This will always reduce the fear and anxiety. It's always we fear most the unknown, what we don't know is going to happen, what's going to come next. Engaging family members and enlisting their helps is greatly helpful. They are an untapped treasure. Many times they sit around, wait around, and we rarely engage them to the extent that we can. Encouraging patient and family members to ask questions is essential. Especially if the patient's condition is poor and they can really engage less in their care overall or ask their questions. After all, those patients and family members, those family members and friends are the ones who's going to take care of the patient as they leave home. Overall, studies show that patients would like to be involved in their care, and they would like their opinions considered, and that their physician asks them about the medical decisions that they are making. So engaging patients in the medical decision making is really important. There has been studies done about shared decision making, and actually those studies show that that shared decision making is associated with higher patient satisfaction and increased loyalty to physicians. So patients whose physicians engage them more in their decision making tend to stay with those physicians more. So last and not least is preparation of patients to go home. Jonathan was headed to a stable recovery. He was scheduled for discharge, but the question was, is he able to care for his knee at home? On the day of discharge, Jonathan was inundated with a stack of papers and forms to sign. A nurse came in to briefly educate him about medications and home care. She told him to refer to the papers for cleaning the wound and for making follow-up appointments as need be with his orthopedic doc. And she mentioned as she walked out the door, and don't skip on that physical therapy. So we know that patients need adequate information about their treatment plan to be able to adhere to this plan and to really recover well as they leave home. They need information about their health condition, what they were treated for, what was the results of their surgery, what medications they're on, what each is for, its possible side effects, any restrictions they have on their diet and activities, what are the signs and symptoms they need to watch out for, what to do if such symptoms develop. They also need to know if there's any tests that have been done for them that they have not received results for yet. We've had situations where a patient has left and had a test done, for example, for HIV, and nobody checked on that. Few years down the road, patient comes back, people figure out that the patient is in fact HIV positive, which is disastrous in a way because they could have received treatment that would completely alter their treatment, their disease course if we knew about that earlier on. So knowing about what tests are done, what things are pending, what biopsy results are not released yet. Also, very importantly, who should be they following up with and how soon they need to be following up. Even better, if they had an appointment made for them, that would be awesome. So for Jonathan, no one asked him whether there was someone to care for him at home, nor whether he would need to climb any stairs to get to his apartment, which clearly would be a challenge for him after his knee surgery. No one seemed to care whether he had a way to get his prescription filled out. As it turned out, Jonathan lived alone in a third-floor apartment, and physical therapy was too far from where he lived. So what is the risk of inadequately preparing patients for discharge? Well, obviously, there's the major stressors on the patient and the major anxieties and difficulties they have to overcome. But also, from a clinical perspective, that puts the patient at increased risk of adverse events at home. There's an increased potential for needing to go to the emergency room. There's increased potential to go to the hospital again back with, say, a wound infection or some complication of his condition. So patients really need to feel confident about their ability to self-care for their condition at home. And this is particularly important after complicated surgeries. And in this time and age where we're keeping patients in the hospital for such shorter time periods and sending them home with much more complicated treatment than we used to before. Sometimes, in real life settings, patients are not adequately prepared to leave the hospital because no one person is really in charge of this activity. Everybody is in charge of the activity, but yet no one is the main person leading that. We believe that it is the health team leader's responsibility to make sure that this preparation occurs before the patient leaves. So what we've been talking about is overall the general aspects of patient-centered care that tend to be really at the core of a patient's ability to have a positive experience with their care and to really be protected in terms of their safety and the possibility of sustaining adverse events after receiving health care. There has been much talk about how systems can actually become more patient-centered, and there has been some recommendations released around that. A lot of conversations about the need to engage patients and families, develop advisory groups within each hospital that advise the hospital on how to make their system more patient-centered. There has been conversations on how healthcare documents need to be tailored for the needs of patients. Patients who have difficulty in reading, patients who have problems speaking a particular language, cultural competency, addressing the needs of patients and communicating with patients from different cultural backgrounds. There's been a lot of discussion about the need to make visiting hours more open, really treating family members and friends as guests in the hospital, as opposed to unwelcome visitors who need to come at particular times and need to leave at other times. There has been much attention to services quality, whether we're offering comfortable accommodations for patients, whether their food is good, whether we're taking care of the room temperature, good air conditioning, things like that. And that tends to be very, very important. There has always been conversations about also making sure that we are engaging the consumers in terms of sharing information about quality of care. And there is a big movement towards that, where we would be, for example, in the US, there is a website called the Hospital Compare website, on which quality metrics for each hospital is reported. Patients, consumers really can check and shop, so to speak, hospitals for the hospitals that are best in delivering particular high quality care, and even reports on patient experiences in the hospital are reported on this website. So in summary, patient-centered care is key to high-quality care and is key to improving clinical outcomes. Main aspects of quality care from the patient perspective include having a caring attitude from the healthcare professionals, in addition to highly qualified healthcare professionals with excellent technical skills and also good interpersonal skills, good communication skills. Healthcare professionals who also respond to the patient needs fast, address their pain control, address their comfort and quality of life concerns, explain care plans in easy terms, and answer questions and address concerns. We also followed a particular patient's experience within the hospital, and we learned that within the hospital, a good action framework to make hospital care more patient-centered is to really focus on meeting patient needs, involving them in care, and preparing them for self-care post-discharge. I'm leaving you with a list of references that you can refer to that I have cited some data from. Thank you very much.